Here's what it says to the business community. If you're a small business person in California, it says that you couldn't offer health care in the past because you couldn't make ends meet and make your own payroll. But you've always wanted to offer health insurance. Now, some companies will pay as little as 1% in order that their workers could have health care coverage. And I don't know one business person that I've talked to in the state of California that hasn't expressed in some way, shape, or form that they want health care coverage for their workers. And so this is about the public interest. This is about the public good. And we were looking for somebody to negotiate a health care plan with. Luckily, we found that person in Governor Arnold Schwarzenegger. Obviously, he is the statewide representative, one of two, obviously, in the Republican Party, but the one that has, obviously, the most public support and a mandate from the public, members, a very important mandate from the public. Because what they like the most about Governor Schwarzenegger is not the fact that he calls himself a Republican and he's got the R next to his name. He's proud to be a Republican, but the fact that he's not driven by the ideology of his party or the ideology of anybody else's party. In this effort, the governor was driven by finding real results to the crisis of health care that California confronts. Everybody here knows that the rate at which premiums are increasing for people with health insurance is but an indication that a health care system in California is teetering on collapse. It needs to be dramatically transformed. AB1X does just that. This is a bill that says that we in the state of California are going to work very hard to make sure that we're going to represent the better interests of the people that we represent, not of my party, of your party, or somebody else's party, because this is not about ideology. If it were, we wouldn't be here today. We would be somewhere else, doing other things. Some of us prefer to have a universal health care plan where nobody has to pay a dollar out of their pocket to obtain it. That's what we support. And I add my name to that list because I think fundamentally health care is a right and not a privilege, and it ought to be afforded to everybody. And any modern government that doesn't offer the very best health care to the haves and to the have-nots ought never call itself a modern government.